Hello, I'm Dr. James Carter, a board-certified urologist with more than 20 years of experience in men's health and wellness. I have dedicated my career to helping men over 40 stay strong, healthy, and confident as they age. On this channel, I will share practical tips, medical insights, and natural solutions that truly make a difference. If you find this video useful, please subscribe so you don't miss future episodes where I break down common problems into clear, realistic steps. Let me begin with a blunt question that most people avoid asking. When was the last time you truly cared for your penis the way you care for your teeth or your heart? I do not mean a quick rinse in the shower or adjusting your underwear. I mean intentional, respectful care, a few small daily habits that show your body the attention it deserves. For many men, especially as they move into midlife and beyond, penis health becomes something they only think about after a problem appears. The good news is that doesn't have to be your story. Over years of clinical practice, I have seen the difference between the men who wait and the men who act. Those who include basic, consistent penis care in their daily life are the men who stay active, confident, and connected to their bodies well into later decades. This is not about vanity. It is about giving a living part of your body the maintenance it needs to function and to feel like it belongs to you. Let us start with the big picture. As men move into midlife, the body shifts. Hormones change. Circulation subtly alters. Nerve sensitivity adjusts. None of that means something is broken. It simply means the support systems that once worked without effort now need a little more help. Think of it like maintaining an older car. It still runs beautifully when you tune it, change the oil, and check the tires. You do not ignore the dashboard lights until the engine stops. The penis often shows early signs of changes in circulation and nerve function, and if you listen, you can act early to preserve function and comfort. At the center of penis health is blood flow. Healthy, steady circulation keeps the tissues soft, flexible, and responsive. When blood flow slows, firmness, response, and sensitivity can decline. Many common conditions you already know about: high blood pressure, elevated cholesterol, diabetes, smoking, long periods of sitting, can all reduce circulation. The penis is a kind of sentinel. It often signals circulation problems long before other organs show symptoms. That makes it an opportunity. When you notice subtle changes, you can see them as a chance to improve your whole body health, not as a sign to retreat. Movement is the single most accessible tool to protect circulation. I do not mean a punishing workout. I mean gentle, frequent movement that keeps your blood vessels open and your pelvic region flushed with fresh, oxygen-rich blood. Walk regularly through your day. Stand, stretch, and move your hips and legs. Take a deep, conscious breath and feel the lower belly engage. Even short bursts of light activity repeated across the day will help maintain the flexibility of small blood vessels and the health of soft tissues. This kind of movement also helps your heart and your metabolism, which in turn supports sexual health. Next, we need to talk about nerves. As we age, nerve signals can slow down. Sensation might feel muted. Response can take longer. That does not mean the system is gone. It means it needs encouragement and gentle retraining. Gentle touch is one of the most effective ways to reawaken sensation. I am not talking about intense stimulation aimed solely at performance. I am talking about non-sexual, mindful touch designed to help your body remember sensation without pressure or expectation. Warm baths, light massage to the lower abdomen, inner thighs, and buttocks, and gentle daily skin care do more than feel good. They increase local blood flow and gently remind nerves how to communicate. Applying a mild, fragrance-free moisturizer now and then preserves delicate skin and reduces irritation. If you are uncircumcised, taking a moment to gently clean under the foreskin with warm water will prevent buildup and discomfort. Avoid harsh soaps, strong fragrances, and alcohol-based products that dry delicate tissue and make sensation less pleasant. There is also a strong mind-body connection at work. Anxiety about performance or a fear that something is wrong increases tension, which tightens the pelvic floor and cuts off circulation. When you approach penis care with curiosity rather than judgment, when you say to yourself that this is an area worthy of attention and not something to be ashamed of, your nervous system responds. Slowing down, breathing, and removing pressure from the moment makes the body more likely to respond in a calm, reliable way. Another practical tool I recommend is targeted pelvic floor work. The pelvic floor muscles play a direct role in erection and ejaculation. Training these muscles gently, as part of a regular routine, improves awareness and control. You can learn to find the muscles that stop the flow of urine, to contract them briefly and then release, and to integrate those contractions into gentle movements. Over time, this practice can make a meaningful difference in firmness and endurance, and it can reduce leakage and urgency for those who experience it. Nutrition, hydration, and lifestyle choices matter a great deal. A heart-healthy eating pattern supports penile circulation. Staying well hydrated keeps nerve impulses crisp and tissues supple. Limit the habits that damage vessels and nerves. Tobacco is one of the clearest examples. Smoking narrows blood vessels and harms circulation, and quitting is one of the most powerful things a man can do for sexual health. Long-standing uncontrolled blood sugar and certain medications can also blunt function. If you have diabetes or are at risk, managing blood glucose with your medical team is a central step. When it comes to vitamins and supplements, the evidence is mixed. Nutrients that support nerve health, like B-complex vitamins, are reasonable to consider if a deficiency is present. Vitamin B12 in particular supports nerve integrity, but routine high-dose supplementation without evidence of deficiency is not necessary and may not help. The prudent approach is testing when there are signs of deficiency, and working with your primary care doctor before starting new supplements. Limit alcohol and avoid excessive heavy drinking. Alcohol can reduce nerve sensitivity and, over time, damage nerves. It can also disrupt sleep, hormones, and mood. Sleep matters. Poor sleep can lower testosterone and increase fatigue, both of which affect sexual interest and readiness. Addressing sleep quality, treating snoring or suspected sleep apnea, and building a regular sleep routine are all part of the broader plan. It is important to say something about medical options in a straightforward way. There are effective treatments for specific problems. Medications, device options, injections, and surgical choices exist and they work for many men. But those options should be explored with a clinician after a careful evaluation. If you are taking medications for your heart or for blood pressure, or if you have a history of heart disease, you need medical guidance before starting certain erectile medications. The right approach blends lifestyle steps, mindset work, and, when appropriate, medical therapies tailored to your health status. Let me give you a practical day-to-day routine you can adapt to your life. Start the morning by moving your body in a way that feels good. Stand, stretch, take a breath that fills your belly, and notice how your pelvis and lower back feel. Throughout the day, make it a habit to stand up regularly, shift position, and walk a short distance. After a meal, take a gentle walk. Before bed, warm up with a brief relaxation routine, perhaps a warm shower or bath, a few gentle breaths that focus on relaxing the pelvic and lower abdominal area, and a mindful check-in that asks only, "How does this feel?" At a convenient time each day, spend a moment on pelvic floor practice. Find the muscles, contract briefly, and release slowly. Finish each week with skincare, a warm cleansing, a gentle pat dry, and a light application of a fragrance-free moisturizer if the skin feels tight. Along the way, pay attention to signals the body gives you. A decrease in firmness, less morning fullness, slower response, or discomfort during urination are all worth noting. They are not reasons for shame, but cues to take action. If you notice these changes, share them with your clinician. An evaluation that includes a review of cardiovascular risk, blood sugar levels, and medication review is a smart next step for many men. I want to tell you 3 short stories that capture how simple changes can make a big difference. The names are changed, but the lessons are real. The first man I will call Mark. Mark came in late one afternoon worried that he was not himself in intimacy. He had been sedentary for years, and he had started smoking again during stressful times. We worked on a plan that began with daily walks and a gradual smoking cessation strategy. We added gentle pelvic floor work and a focus on sleep. Within weeks, Mark noticed a warmer sensation, better morning fullness, and an easier connection during intimacy. The change was not instant, but the steady habits opened the door to consistent progress. The second story is about Luis. He had been diagnosed with diabetes years earlier and accepted that limitation as inevitable. Once we optimized his blood sugar with small medication adjustments and a realistic exercise plan, and once he started a mild pelvic floor program, he reported clearer sensation and regained confidence. His partner noticed the change too, and their communication about intimacy improved. The lesson here is that chronic conditions can be managed, and improved metabolic control often supports better sexual function. The third story is about Tom. He was anxious and watched every minute of performance, which raised his tension and reduced spontaneity. We worked together on breathing practices, removing expectation, and replacing performance pressure with curiosity and presence. He learned to reduce tension, to enjoy touch without goal-oriented thinking, and to invite his partner into a simpler, more human way of connecting. Over time, his responses became more reliable and his relationship deepened. All of these examples point to a central idea: consistency matters more than intensity. Small daily habits practiced with attention and compassion build the conditions for function and connection. There are a few practical cautions I need to share. First, if you experience sudden, painful changes, blood in the urine, severe difficulty urinating, or a rapid loss of function, seek medical attention promptly. Second, before beginning any medication or new supplement, check with your healthcare provider, especially if you take medications for the heart or blood pressure. Third, be cautious about unproven treatments marketed with grand promises. When possible, rely on evidence-based care and clinicians who will evaluate your whole health, not just a single symptom. Before we wrap up, let us talk about relationships, because penis care is not only a medical issue. Many difficulties in sexual function are as much about communication, expectation, and emotional safety as they are about blood flow or hormones. If you have a partner, open the conversation with curiosity. Say, "I want to be closer to you, and I want to take better care of my health." Invite them to be part of non-sexual touch, to join gentle walks, or simply to listen. If you are single, know that this work benefits your overall life and your future relationships. Reclaiming comfort in your own body changes how you move through the world. Now, let me summarize the practical takeaways I want you to remember. Your penis is not separate from your health. It is an early indicator and a reflection of circulation, nerve health, hormones, and stress. Focus on gentle, regular movement to protect blood flow. Practice mindful, non-sexual touch to preserve and retrain nerve sensitivity. Keep skin care simple and gentle. Support your metabolic and cardiovascular health through diet, activity, and avoiding smoking. Pay attention to sleep and limit excessive alcohol. Use pelvic floor work to build muscle awareness and control. And when something is persistent or concerning, see your healthcare provider for a full evaluation. If you decide to try a routine, be patient and kind to yourself. Progress is often gradual, and the most meaningful changes are the ones that integrate smoothly into your life. Treat this practice as an act of respect and maintenance, not a performance trial. Over time, these small choices compound into real, measurable improvements in comfort, confidence, and intimacy. I want to leave you with a few questions to think about and to share in the comments. Which part of this routine feels the most doable for you right now? Which habit feels the hardest to start? Have you ever noticed early signs that your body was asking for attention before a bigger problem appeared? Share a short thought in the comments so others can learn from your experience. Your story may help another man take the first step. If this video helped you, please subscribe for more honest, practical men's health advice. If you know a friend, a brother, or someone who needs to know that it is never too late to take care of themselves, share this video. Leave a comment with your question or experience. If you want future videos that dive deeper into any element, detailed pelvic floor coaching, sleep and hormones, or how to talk with your partner, tell me what you want to see. Thank you for being here and for taking a moment to listen to your body. Remember that the best version of you is not behind you. It is waiting in the habits you build today.